Thank you, Mr. Chairman. Mr. Acting Secretary, David, good to see you both. First, I want to ask about the school-based access program. For maybe 1 to 2 years now, school districts have had issues with coordination and payment between the department and Department of Education. I understand that there's a new contract for a vendor going out for RFP. Can you kind of go into a little bit of detail about how you're trying to better the program for school districts, make it easier and kind of coordinate it a little better?
So I think there were two things going on. I think that when some of the concerns were raised about the program, there was a change in vendor, and a lot of folks associated the change in the program with the change in vendor. While there was a transition going on, the other thing that occurred was there were changes in federal rules that made the program a little more complicated. So regardless of who the vendor was, there were going to be some issues there, and there are some absolute growing pains associated with that, and it's been tough for everyone. We have tried to be clear about, in the process going forward, the RFP is actually out on the street right now, that we have put some new clauses into the contract we will sign with a vendor that will give us a little more control and a little bit, and allow us to, whoever the vendor may be, have a little more accountability for the services that are provided. So as we go through that process, and the RFP is available on our website for anybody who wants to take a look at it, we're hopeful that those changes that we make will make it so that we'll be able to better manage the program through the vendor that is providing the service.
Good. That is some good news. In your county, we have seen many personal care homes closing due to their inability to care for their residents at their lower reimbursement rates. These homes serve low-income Pennsylvanians with disabilities. I've heard from personal care homeowners throughout Pennsylvania the same message. How will we ensure these barely surviving homes stay afloat with a proposed 1010 minimum wage not tax, but 1010 minimum wage possibly coming?
Well, I think that an increase in the minimum wage will help get better workers there, but I think ultimately the long-term answer for personal care homes, for assisted living, for nursing homes, for the long-term care system in the state is we have to begin the process of moving to manage long-term care. Right now, the system is not managed, and as a result of it, there are many folks who aren't getting the appropriate level of service, and they don't have the quality of life that they need. If we're going to have a true continuum of services and we're going to have care that's managed, we have to go to long-term care. Right now we're working with the University of Pittsburgh on best practices, and we hope to put a proposal that will encompass the entire range of services that are provided to folks with, to seniors and to folks with disabilities. A proposal or I'll say a discussion paper out there for folks to react to. We hope to do that in May, and then after going through some stakeholder meetings and discussions, I think it's time to move forward and try to implement those things so that we can get to managed care. So there are all kinds of folks who are caught in the system. They go to a nursing home when they don't have to. They're served in an inappropriate setting. If we can get those systems right, we can get those cost balances, we can get our costs under control, and that's the only way that we're ever going to be able to provide a better rate for things like personal care homes and every type of provider in the system.
Are you looking for a specific rate increase to cover it within your budget for personal care homes?
Not a specific rate increase, no.
Okay. Have you analyzed the between cost of a minimum wage increase into your budget?
Right now, our budget does not include the effects of a minimum wage increase. I think should the General Assembly see fit to work with the governor on his proposal, we'd be happy to engage in that process, and I think it would be something that would have a great benefit to many of the people we serve. I know there are about 40,000 folks who receive SNAP benefits right now, or what used to be called food stamps, who would be lifted out of poverty if there was an increase in the minimum wage. And there are about 60,000 folks who get the child care subsidy who would also see their incomes rise if the minimum wage was raised. So I think there's an impact on real families' lives, and I hope that the General Assembly and the administration can work together to make that happen.
I had a meeting 2 Fridays ago with some advocates for the minimum wage. They have said that the welfare budget will be reduced if we do an increase. In past practices, when we have done minimum wage increases, has the Department of Welfare budget been reduced because of that?
I think there's always folks that will get off of will be no longer eligible for certain benefits when the minimum wage kicks in. Sometimes that's hard to see because if you have an overall growing population as you do in Pennsylvania, and that happens for a lot of reasons, sometimes you don't see that. But yes, there are absolutely folks who will no longer be eligible or require benefits from the department with an increase in the minimum wage.
Okay. Since you have the opportunity to be the head of the largest state department in the entire country. Do you know the cost of any new potential employee contracts, union contracts that are being negotiated right now, and are they built into your budget as well?
I think those contracts are still being negotiated, right?
Yes, there is nothing specific built into the budget right now.
Nothing in the budget now. And
So GGO line item doesn't.
Dave, if you would, that's it. Thank you.
Yeah, there's nothing specific in there right now. I mean, we do work with the administration as we're going forward with this. We do put in increases for our salary increases, benefit increases, but nothing as far as anything above and beyond.
So GGO line item for this year is predicated on current employees, current structure of contracts.
Yes, and whatever we had in there for increases.
I'm going to ask these questions just because I've gotten I don't knows every time I've asked them.
okay.
So has anybody in the administration advised you to not discuss the sales tax expansion?
To not.
To not discuss it?
No.
Has anybody from the administration advised you to say, I don't know, to the questions about sales tax expansion?
The only time I've been advised to say I don't know the answer to a question is when I don't know
know.
the answer to a question.
Good. Good. That's good to know. So I do have the sales tax plan in front of me. It's right here, 144 pages, over 550 new taxes. Have you analyzed this to see the impacts on your stakeholders and those receiving under DPW's care?
I think that I've seen a spreadsheet developed by the Secretary of Revenue about the impact that it might have on some of the folks that we serve, yes.
What is that total amount?
Total amount, I think I could refer you to Secretary McNulty's spreadsheet. I don't have it with me right now, but we can provide it with you.
When did you see that from the department?
The last couple of weeks have been a little bit of a blur, but
All
it's been the last couple of weeks.
Okay, because we had her first. I asked her questions. She had no idea, and that worried me because she's supposed to collect it. So
I wouldn't take my day to the bank. I've had a lot of meetings over the last couple of days, so I'm not 100% sure when I've seen it.
I can definitely believe that. But what we're looking to tax, I'll go through some of them here. Home health care services, providing skilled nurse services in the home. Personal care services, homemaker companion services, physical therapy, medical services, medications, medical equipment, supplies, counseling, 24-hour home care, occupational vocational therapy, dietary and nutritional services. I apologize to you. I have this. I'll give this to you. Speech therapy, audiology, high-tech care, including intravenous therapy, other ambulatory healthcare services, nursing healthcare facilities, residential, intellectual and development disability, mental health, and substance abuse facility services provided by group homes, intermediate care facilities providing residential care services for persons diagnosed with intellectual and developmental disabilities and mental health and substance abuse illnesses, continuing care retirement community and assisted living facility services for the elderly, providing residential and personal care services with or without on-site nursing care, individuals who are unable to fulfill the care for themselves, do not declare themselves to live independently, individual and family services, including non-residential social assistance services for children and youth, such as adoption and foster care, drug prevention, life skills training, positive social development, non-residential social sickness services to improve the quality of life for the elderly, persons diagnosed with intellectual and development disabilities or persons with disabilities in such areas as daycare, non-medical home care, homemaker services, social activities, group support, community food and housing, emergency and other relief services, collecting, preparing, and delivering food for the needy, distributing clothing and blankets to the poor, preparing and delivering meals to individuals who, by reason of age, disability, or illness, are unable to prepare meals for themselves, collecting and distributing salvageable or donated food, preparing and providing meals at fixed or mobile locations such as food banks and soup kitchens, providing community housing services such as short-term emergency shelters for victims of domestic violence, sexual assault, or child abuse, temporary residential shelters for the homeless, runaway youths and patients and families caught in medical crises, and transitional housing for low-income individuals and families, providing volunteer construction or repair of low-cost housing in partnership with the homemaker who may assist in construction or repair work.
Excuse me, Representative.
Yeah.
Is there a question?
We'll get to it. Providing shelter, clothing, and medical relief, resettlement, and counseling to victims of domestic or international disasters or conflicts. And I believe it completely removes sales tax on Here it is. An entity which is authorized to do business in this Commonwealth as a nonprofit corporation or unincorporated association of the laws of this Commonwealth, which include youth, sports, volunteer fire, ambulance, religious, charitable, fraternal, veterans, or civic associations, and a separately chartered auxiliary of the association operating on a nonprofit basis. It's a lot. That's just the short blurb of what is actually new taxable under the sales tax plan. Is that going to be beneficial for Pennsylvania residents moving forward?
I think at the end of the day, I think both the governor and Secretary Albright have made clear that it's a comprehensive plan that you look at as a whole. Sure, what I always want to look at the folks that I serve first and try to exclude them from any change. Of course I would. But at the end of the day, I know that my department is part of a bigger picture in this state. And I know that when you're looking at the fiscal challenges that this state has, the time for gimmicks and excuses is over, and you need to find a way to plug the revenue hole that we have. I think the governor's plan is one that will comprehensively address those holes. And I think that as I was listening to you list all those things there, and presumably you would be against including them in any tax increases, to come up with an alternate plan and a way that we can plug the revenue hole that we have if we are not going to do those things.
I appreciate that, and I think it shows a difference between governing of adding those 550 taxes on some individuals that barely able to survive on a day-to-day basis. To add that, one's cable TV, not the premium channels, but the regular, and I know a lot of individuals have that too. So it's just a compounding effort that we're going to drive money into these programs, but we're going to take it from them on the front end. So I appreciate that. Thank you, Mr. Chairman.